In this video, we're going to look at how Physiopedia's AI assistant, PAI, can help us write a SOAP note. Let's open up PAI in our Plus account. In order for PAI to write a SOAP note, we'll have to give it some patient information. I'm also going to turn on dictation so that I don't even have to type it in. You can do this on your computer or your phone, just look for the button with the microphone on it. Let's say I want to discuss this patient case with PAI. I'm just going to give it some subjective information first. My patient is a 50-year-old female reporting a radiating pain in her right arm and shoulder, which started 2 weeks ago. She reports that the pain goes up to a 9 out of 10 when aggravated, but can come down to a 4 out of 10 with medication prescribed by her doctor. Sometimes she gets numbness down her arm as well. Pain is aggravated by having her arm hanging when walking, bending her neck, and turning her neck to the right side. Pain is eased by resting her arm on the counter or laying on her right side. She is having difficulty sleeping at night. Just with this information, PAI has already come up with a hypothesis and made some suggestions for the objective assessment. So let's give PAI some of that information. Cervical flexion range of motion is normal with pulling in the upper back and right shoulder. Extension is 30 degrees with pain in the right shoulder. Right rotation is 60 degrees with pain in the right neck and shoulder. The rest of the movements are normal. C7 myotome triceps extension was weak. Sperling's test was positive on the right. Upper limb tension tests were all positive. Cervical distraction test was negative. Neck disability index score was 21. There is tenderness on palpation along the right C7 and T1 paraspinal muscles. At this point, assuming that you agree with PAI's hypothesis for this patient's condition, let's try asking PAI for a SOAP note. If PAI needs more information, it'll ask for it. So let's give PAI this information. Now we get a SOAP note with the subjective and objective information we gave PAI. It has also provided the assessment based on this information and come up with a treatment plan. As always, if there's anything you want to change or you're not sure about, just ask PAI to modify it or discuss it further with PAI.